Thank you for coming. How many veterans do we have in the room today? Could you please stand up? Congratulations and thank you for your service. And I also would like to recognize the spouses of veterans because some of them go through an awful lot. And I know there's probably a couple of you in the room. So happy Veterans Day to all of you. I will call the Marathon County Public Safety Committee meeting to order. Today is Tuesday, November 11th. It's 1:32. And our first item will be the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, number 3, public comment. We have 4 people signed up. I will call your names to come up. You will get 3 minutes to say what you have to say. So our first public comment speaker is Donna Ambrose. Yeah, you speak to the chair.
Okay, thank you.
Into the microphone. Just, yeah,
There we go.
there we go.
There we go. Thank you. Hello, good afternoon. I am speaking today in opposition to the implementation of 287G. My name again is Donna Ambrose, and I'm with the Neighbor's Place, a local food pantry and basic needs bank that serves anyone who comes to us in need. Every day, we meet parents doing their best to feed their kids, grandparents stretching every dollar, and neighbors just trying to get by. Some of them are undocumented. Many are scared. But when they come through our doors, we don't ask about their status. We ask how we can help. When local law enforcement works with ICE to report anyone in jail without documentation, even for the smallest offenses, it creates fear. And that fear keeps families from coming to us for food and basic needs. It keeps kids from getting what they need. No one should ever have to choose between feeding your family and being safe. Hunger knows no borders, and neither should compassion. We'll keep our doors open to everyone because that's what our community is about. Thank you for your time.
Thank you, Donna. Next is Tony Gonzalez.
Good afternoon. I came to talk against the adoption of 287G jailhouse model here for Marathon County. We got here not just because of one party or the other. We're here because of the zealousness of both sides, and it simply affects those in the middle, the good working people in Marathon County. One side sues, and the other one is catering to those that vilify immigrants. 287G is a program that simply targets communities of color. Though we understand that the jail model that was adopted will only affect those that end up in jail, it's dangerous. Today we have to make sure that until we make it end, we have to make sure that it does not become a conduit from jail to deportation. 287G is going to hurt our economy further, decline because of decline in workforce, purchase of goods and services. It's going to hurt public safety because immigrants would no longer feel safe reporting crimes, medical emergencies, fires, cases of domestic abuse, etc. And law enforcement and the county is opening themselves to lawsuits to a very high degree because if by any moment they get the wrong people or arrest or detain the wrong person, the county will be sued, and this is not going to be paid by the federal government or ICE. It's going to be paid from the sheriff's bottom line and the county. It just simply erodes public safety. And it's nothing that we needed in this county because we do not have the numbers to even worry about violence with immigrants. Our sheriff said it at one time, less than 1% of the crimes that occur in Marathon County occur by immigrants. So we oppose 287G. We cannot do nothing right now, but we hope that with the show of community and the people we're gonna have here, it'll easily show that this is not what we want and that there was not enough clarity and enough announcement that they were going to adopt it, and it just got done without public opinion at all. So I think that's a terrible thing. If the public would have came out, we would not be here today. So we hope that eventually we'll get this done and people start appreciating those immigrants that are here in a county that has very many dairy farms and packaging that depend strongly on immigrant labor, knowing who's working there. So I hope we get this over with sometime soon. Thank you.
Thank you, Tony. And next is Mark Bradley.
Good afternoon, and thanks for this opportunity. My name is Mark Bradley, and I'm here on behalf of OLA, a nonprofit organization in Marathon County. OLA stands for Healthy Opportunities for Latin Americans. We provide blood pressure screenings, diabetes screenings, vaccines. In short, we're essentially a health service organization for Latino families that reside in Marathon County. I also would like to address the sheriff's recent decision to sign the 287G jail enforcement agreement with ICE. Because no training has occurred yet, the program is not active, and therefore I think this is the right moment for this committee to exercise its oversight. And that responsibility connects directly with this committee's mission as published on your website. One of those things is alignment with your strategic plan. In that regard, public safety in Marathon County, as was mentioned, depends on trust, it depends on cooperation and fairness. And across the country, communities with 287G programs often report a reduced willingness to report crimes or cooperate with deputies, particularly among victims of domestic violence or wage theft. And if residents fear that contact with local law enforcement may lead to immigration consequences, they may hesitate to come forward. And that, of course, just undermines the county's strategic goal of safety and community engagement. Second, meaningful oversight by this committee requires transparent, reliable data. And without it, this committee cannot evaluate whether the program is meeting the public safety objectives. Around the country, counties with 287G agreements have often struggled with limited reporting or incomplete information from ICE. So to fulfill your mission of monitoring outcomes, we recommend that you require routine public data on several points: the types of arrests that trigger immigration checks, the number of detainer requests that are issued, the length of additional jail stays that related to immigration procedures, and any reimbursements, and especially any lack of reimbursements from ICE. Our point is simply that data must precede conclusions. Third, public safety includes protecting the county from unnecessary liability. And as was mentioned, jurisdictions around the country have faced lawsuits tied to improper detainers and civil rights violations.
I have 15 seconds left. So.
And these costs are borne by the county. They are not reimbursed by ICE. So for those reasons, we recommend that this committee exercise its oversight through the implementation of this 287G agreement. Thank you very much. Thank you.
And next, I'll probably slay this last name, Mariana I can't pronounce it. Sabella. You say it much prettier.
Good afternoon. My name is Mariana Sabella, and I am here representing OLA, Healthy Opportunities for Latin Americans. I don't have any papers with me. I don't have any data with me. I came to talk to you from my heart. We are serving the Latino community in 8 counties, and what we are seeing is unbearable to continue seeing. Families are very worried, are very stressed, and what it worries me very much is that a lot of these families, they don't have the documentation to even qualify for health care, and they are already suffering from mental health, from issues, from stress, from trauma, and all the things that we are seeing on the news, like what is happening in other counties, what is happening in other states, and our neighbor state in Illinois, all the things that we are seeing are in detriment of trusting the law enforcement. So I'm here to counter the 287G program. We all deserve to be in a community where we are thriving, and we are not seeing that. This country was made and was built with immigrants, and it's good to have a diverse community, and we are not seeing that. So we strongly in OLA oppose to the 287G. And I'm so glad to see so many people here. I am seeing friends, I am seeing neighbors, I am seeing colleagues from different nonprofits, people of faith, from churches, from other organizations, that we are here together asking you to take that off of the table, because that could be reversed. Thank you.
Thank you very much, and thank all of you for coming. We appreciate it. Okay, moving on. Number 4, approval of the October 7th, 2025 Public Safety Committee meeting minutes. I need a motion. Motion by Deb. Second?
Second.
Thanks, Yi. Are there any additions or changes? All in favor? Aye. Aye. Opposed? Moving on. Operational functions required by statute, ordinance, resolution, or policy. 5A, discussion and possible action by public safety, none. 5B, discussion and possible action by public safety to forward to the county board for consideration. 5B1, consideration of renewal of joint powers agreement with City of Wausau for 911 services.
I can, if I can, Madam Chair, I'll tee it up, and I see Captain Weber's in the back. I'll defer any actually substantive questions to him, if he's capable of handling those as well. But this is a recurring item that's on your agenda for those of you that have been on the committee for a while. It is the longstanding agreement we've had, and within the state of Wisconsin, each county needs to identify a single public safety answering point that is then eligible for grant services. Quite a number of years ago, the City of Wausau partnered with Marathon County to allow for Marathon County to serve as that single public safety answering point. Therein leads to the annual renewal of the E911 NG 911 Joint Powers Agreement. So the draft agreement is up on the screen in your packet. Also in your packet is the agreement from last year.
Okay, thanks, Lance. Any discussion by the committee? Okay, then we would need a motion to, before we move this to the county board.
Correct.
Motion by Al, need a second. Second by Deb. Any comments? All in favor, say aye. 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 Opposed? Motion carried.
Thank you.
6, educational presentations and committee discussions. 6A, discussion of the 2026 annual budget with respect to departments and organizations over which the committee has jurisdiction. Is that yours too, Lance?
Sure, I can start, and I know HR Finance and Property Committee Chair Robinson is here as well. This is a recurring item on your agenda. You, of course, have your budget adoption hearing this evening. If you have any questions or comments, I know I had the opportunity to speak with Supervisor Sandelsky. I think he's considering one budget amendment that isn't in the packet for the county board. It would be germane to this committee specifically. And please correct me if I'm wrong at any point, but considering offering an amendment this evening to the budget to increase the fee within the fee schedule as it relates to the jail day stay fee. Currently, it's at $18 for an in-county resident for the subsequent day jail stay fee. The proposed budget had that going to $20. And I understand Supervisor Sandelsky is considering offering an amendment to increase that to $23 with the intent that After the budget, staff work with this committee to bring forward a policy change to essentially set up a non-lapsing rollover account where those funds would be tracked and held to ensure that they be utilized, that increment be utilized to provide a funding mechanism for the county's K-9 program within the sheriff's office in the event that those revenues were insufficient. So I don't know if I stated that correctly.
Go ahead, Jason.
Thank you, Chair. What percent of inmates actually pay the fee?
That's a very good question, and I'll pull up our finance director after Supervisor Sandelsky raised this question recently, did a bit of digging. The short explanation is that fee is only charged for individuals post-sentence, and post-sentence individuals, I should say individuals serving a sentence that are in the jail. Those individuals make up a minority of the jail population. Currently, jail population is made up more so of individuals awaiting for their case to move through court and or individuals on holds through probation, parole, or on extended supervision holds. So the $3 incremental increase based on our initial estimates could yield, if we had 100% collections on our current practices, between about $16,000 and $18,000. But I think as I alluded to before, the idea would be that we would take time after if that amendment were offered and if it were successful. It really doesn't cause for any additional programs to be offered. That revenue line within the budget is a multiple revenue line, so more than just the fees from that jail stay fee are deposited there, and historically we've fallen short of those revenue projections, generally speaking. So I think it would be a good opportunity if that budget amendment were offered and it would pass, to take a first couple months to really track to see what those collections look like as we set up that non-lapsing account for that increment to be deposited in.
John, do you have anything to add?
Not specifically on this issue, but I too would be concerned about what would be the net impact to the county. I think one of the concerns that I would have on this issue would be how much further behind do we put those individuals when they can come back into the community when we start increasing the fees associated with them. They're already, they have a difficult time getting employment because of their record and others. I think there are a number of factors that would merit, which is one of the reasons why we started the budget deliberation process early, to encourage people to bring forth ideas early in the process, to let us vet those and do it. But ultimately, it's up to the board to decide the policies. In terms of the overall budget, the committee yesterday advanced or recommended two of the amendments that were before us, one dealing with the use of the increase in the general transportation aid for overages and costs that we're expecting on a culvert project. We received about $194,000, an increase in our estimated receipts for general transportation aid of $194,000, and that will go a long way toward covering the projected cost overruns on a culvert project of $225,000. So we're moving it, we're applying it to that project. The second one was to take the current stipend that the county board has for internet services and put that into the base salary, with the thought that the stipend creates an administrative burden on the clerk's office, and that it would make it easier. We'll just put it into the base salary for the county board, and those will be up tonight. There was another amendment that proposed to use the same general transportation aid that we use on the county culvert project and use that for debt service reduction to buy down the levy. The committee adopted the use of it for the transportation purposes on a 4-2 vote. arguing that an increase in spending has a 6-year benefit to the county under our general transportation aids. Whatever our 6-year average drives our reimbursement from the state, and that's currently approximately 20% of our cost. And we would be able to roll that $194,000 into the rolling average over that 6-year period of time. So it would be a positive long-term benefit to the county.
Thanks, John. Yi?
Thank you, Madam Chair. Going off Supervisor Sandelsky's amendment that's going to be brought up here, I did have a conversation with the sheriff in regards to whether how much of the fees is actually paid. And from my understanding here, it's not paid often as well. And I guess I know that Administrator Leonard mentioned that the fees that are collected would also go towards funding our K-9 units. But from my understanding here, and correct me if I'm wrong, our K-9 unit is 100% so far funded by the general community. Is that correct here?
To the second question, I would say portions of the program are funded by the community. That said, the deputy salaries and the increased special activity type pay that goes to those deputies as they serve in that K-9 capacity, that's funded through the general levy. And I'm going to oversimplify here, and Ryan, keep me honest if you know the answer, but costs for new dogs and things like food, vet appointments, those things are funded through, have traditionally or historically, I should say, been fundraised through the local community. But again, there are other areas, and I haven't had time to drill into exactly what all those are. But in speaking with Supervisor Sandelsky, that was part of the thought of an area to study, not only how much of that increment is actually collected, but also what are those costs that you could potentially fund over time with that non-lapsing account. And if I could go back to Supervisor Wilhelm's specific question, I knew I had it before. In speaking with the jail administrator, approximately between 15 to 20% of our jail population on any average day was his estimate of what's made up of sentenced inmates.
Thank you. Anyone else have any comments or questions? Okay, moving on. 6B, we have Ruth Heinzel here from the DA's office, and they're going to do a presentation on deflection and diversion program. Oh, we have our DA here too. A whole army, right?
Yeah, Ruth, Nikki, and Dana, take it away. I'll get out of your way. Oh, good.
Hi, everyone.
There you go.
Oh, there you go. Okay. Hello, everyone. Good afternoon. Thank you so much for having us here to talk about our wonderful deflection and diversion programs in Marathon County. Before we get into the meat of our presentation, I wanted to introduce my team. So our lead deflection specialist is Dana Bittner. She works directly with law enforcement to connect people who have substance use or mental health challenges with treatment or services. The number one reason I think our deflection program has been so successful, we started this about 2 years ago, is because of Dana's passion for helping this population and for working with law enforcement. I do hear often law enforcement complimenting Dana on her hard work and talking about her passion, and multiple times law enforcement has discussed about how she has been pivotal in saving many people's lives in this county. Nikki Delatolis is our diversion specialist. She's our lead specialist. She works with prosecutors on helping put together offers and refer people to services to help them take accountability for their crimes and possibly rehabilitation for themselves or reparation for victims. She has also been amazing with the growth of all our programs. She's probably the reason we're able to be successful in obtaining all the grants that we've obtained over the last couple of years with all of her hard work and expertise on grant writing. And she's just been amazing with even helping us get published, nationally recognized, even on an international publication, and has amazing skills in those areas. And then there's me. I've worked in the district attorney's office for 10 years. I've been working in diversion for 15. I think the reason that I've been in this program for so long is that I'm just really passionate about connecting the criminal justice system with the mental health system and helping us work together better and collaborate better and serve the people of Marathon County the best that we can, as cohesively as we can. So going through our goals for today, we're going to try really briefly to go through all the programs that we do. We do a lot of things, so we're going to be really brief about them. Since you are county board members, we are also going to be talking about funding, how these programs are funding, and then a simple cost-benefit analysis. So this is a very busy slide, but we're going to talk about colors. So the first part of our presentation, we'll talk about the yellow and orange colors. So this is the diagram of the criminal justice system. So the first part, we're going to be talking about deflection. This is where law enforcement has discretion, and they work with Dana through deflection to refer people to her instead of the traditional criminal justice process, which this diagram maps out. Then we'll go through the blue and purple sections. It kind of looks pinkish, I guess. This is where prosecutors make discretionary decisions, and they work with Nikki to help get people additional services or lots of other things that we'll go into detail later. So before we get into deflection, I think I would be remiss if I didn't talk a little bit about the Wisconsin Deflection Initiative. The gratitude I have towards the Wisconsin Deflection Initiative is so much because they've provided a lot for us and a lot of resources and have really brought a bunch of counties together. So there's 13 counties as part of the Wisconsin Deflection Initiative. The Wisconsin DOJ runs it, and this is where the funding gets cycled through to fund our programs. So all of our deflection funding goes through the Wisconsin Deflection Initiative. We meet monthly to help share wins and barriers, and we also have peer-to-peer guidance, which we're heavily involved in. Wisconsin also has worked on some published guides that you are more than welcome to look up and read if you would like to learn more about deflection, and it helps us be all on the same page, all the different counties, which has been super helpful with continuity. I also want to thank the Sheriff's Office. So the Sheriff's Office was the first county to join the Wisconsin Deflection. Well, Marathon County was the first county, but the Sheriff's Office led our involvement in the Deflection Initiative. And they worked really hard in being innovative in starting the deflection program and collaborating with our office as we transitioned the deflection programming from the Sheriff's Office to the DA's office. They've been a great champion for us, and I really appreciate their openness and willingness to help. So funding. Dana's position is currently funded by JAG as of October 1st. The funding for JAG 2026 went into place. She was previously, the first 2 years of the deflection program was funded by COSEP grants. And then last year, COSEP is a federal initiative. So there was a COSEP grant that originally funded Dana's position. And then due to the state really liking deflection and wanting to move forward more with deflection with how successful it has been, they decided they wanted to continue funding for deflection for counties through their JAG funding. So their JAG fund funds Dana's position, a part-time deflection position assistant. We hopefully soon will start our peer support contract. This is a new thing that this grant is funding. And then it also comes with a requirement of us being a mentor site, since we're one of the original counties that were part of the deflection program. And also the state is super excited that we are the first regional expansion of our program. Most programs are just within one law enforcement agency, where we're able to reach our whole county. So second grant, this is a brand new grant, started July 1st. So like I said, Dana was originally funded by COSUP. Now we have, the state got new funding under COSUP. So, they put out, a proposal for us to apply for, and we got, 2 COSUP grants. So the first COSUP grant and the second COSUP grant mirror each other. They both, have one deflection specialist and then funding for treatment, sober living, and other supportive costs. The first COSUP grant that we have is more catered towards the Wausau metro area, so that would include Cronin, Water, Rothschild, Weston. And then our second COSUP grant is more catered towards the rural areas. And like I said, they mirror the same thing, so they have the same funding for the same things.
Deflection, in a nutshell, has 2 main tenets. The first and foremost one is that it is law enforcement led. We really wanted to give law enforcement a seat back at the table and have discretion in how this program is going to work as we work to connect people in the community who are struggling with the necessary supports and resources. The second main tenet is that everyone in deflection has an underlying substance use challenge. So when I refer to substance use, I am referencing both drugs and alcohol, not just one or the other. And there are predominantly a lot of cases who have co-occurring mental health challenges along with those. On the slide here, you'll see there are 6 potential pathways by which individuals could get referred to our program. However, we have had our most success with the 2 pathways that involve law enforcement discretion. With our expansion, we have big plans. We have split it into 2 different expansion cohorts, the first being the Wausau Metro expansion. What we would like to do is increase our capacity to respond to overdoses in the community and get people and their families connected with the necessary services and supports so that they can continue moving forward. We also are hoping to increase our co-response capacity with law enforcement. So what this looks like is at the moment when an officer has contact with an individual and they're struggling, they can call us out to be part of that conversation and help get people connected to the services that they need more immediately rather than waiting and trying to follow up with them after the fact. We also are hoping to continue expanding our program so that we can have more of a reach over high need cases within the metro area. We also work with the community care paramedic who has done a great job of bringing healthcare back into the home and meeting people where they are at who may have transportation barriers or other challenges so that they're unable to receive care, like through primary care. And so Matt does a really good job of meeting them where they're at and making sure that they receive the care that they need. He does not specialize in substance use challenges, so when he has an individual in the home that he knows is struggling, he can call us and we can meet him out there to make sure that they are connected with a holistic approach and that they're connected to all the systems of care that they need to be connected with. Mickey McGuire is our new deflection specialist that is assigned to the Wausau metro area and will be working on expansion in that way. Our co-response model with Cronin Water Police Department has gained a lot of attention both in the state and nationally. We have a co-response model with the police department where every time an officer has someone in mind for deflection, they call us and we schedule time to go and make a house visit to meet this person together where we're at. So that way they're meeting with a law enforcement officer who's a familiar face to them, who they share details with, and then they also can do a warm handoff directly to us so that we can help get them connected to services right away in a compassionate manner. The wonderful thing about the co-response model is that we can do med clearance for people who need to go to the healthcare center or they need to get directly into treatment services at that time. So rather than having law enforcement sit in the emergency department, sitting 8 to 10 hours potentially on a med clearance, if there's not a need for them to be there because of public safety, we can sit through those med clearances and we can take it from there so that they can get back to the calls for service that they need to on patrol. It's also great to have a partner at the time of service because some of our clients have significant needs. So having us co-respond means that one person can talk with the individual who needs support. There's another person who can be on the phone with the crisis center or call Adult Protective Services or whatever it is that we need to start getting the ball rolling on. And it's a very joint effort and it's very efficient. So we are hoping to expand the way that we do things in accordance to the co-response model as we move forward, just because of how effective it has been and the positive feedback we've gotten from law enforcement on how that saves a lot of time and resources for them. We also have a great partnership with our downtown officers through the Wausau Police Department. These folks help us specifically target the unhoused population who have a lot of needs, predominantly substance use, co-occurring mental health, housing barriers, and other barriers to service. So we will regularly work with them to do regular rounds in the community and do co-response, especially in high traffic areas where we know that these individuals are likely to hang out during the day. We have really moved the needle on helping people take steps out of homelessness, and we wouldn't be able to do it without the help of these downtown officers specifically. They help us track down people if they're looking for somebody. The unhoused population doesn't have access to a cell phone. They don't have an address, so we can't send them a letter in the mail telling them that they need to appear to my office to talk with me. So we really need to meet them where they're at and be vulnerable with them where they are. And we wouldn't be able to be successful in tracking down these people if it wasn't for the assistance of the downtown officers. The second part of our expansion is to focus on the rural areas. The Sheriff's Office has been instrumental in helping us be accessible and mobile so that this goal is realistic for us to engage other parts of the county. We are finding that substance use challenges look different in different parts. So even though the cohort may not be as immediately visible as they are like the unhoused population in the heart of the city, they still exist. And it's hard to ask somebody to drive 45 minutes from a rural part of the county to get to Wausau to access services. So we need to be mobile and bring our services and supports to them. We are hoping to better serve the full county, make services accessible, make ourselves accessible and available, and engage the smaller law enforcement agencies so that we can help them in the same way that we are assisting in the Wausau metro area. Jalen is our deflection specialist who is assigned to the rural expansion, which we will begin with the Sheriff's Office in the next couple of weeks here. So we're really excited. We have a lot of lofty goals, and I think there's a lot of areas that we still have yet to reach. So that's really exciting for us. My role will be changing slightly, which is exciting for me. I will still continue to be the main point of contact for law enforcement for all things deflection, just so that they can have a familiar face with a familiar operation. The work that we have done has worked really well so far, so we want to continue to be that support for them. I will also be responsible for staffing and training and oversight of our new deflection specialists. I will still be involved in community presentations, stakeholder engagement, and I will still be participating in our special teams, such as our drug endangered children team, our fatal overdose review team, the suicide death review team, and others that we are a part of, so that we can continue to collaborate across systems. We have a really interesting relationship in deflection with our community resource unit and the federal Central Wisconsin Narcotics Task Force, which I think is pretty profound considering what we're asking them to do. As a result of drug investigations, law enforcement is really good at figuring out who the suppliers are and who the buyers are in the community. And we are asking them to take a good look to see who really is not necessarily need to be involved in the criminal justice system, but they need an opportunity to get help so that they get away from the people that they are purchasing from. So law enforcement really focuses on the supply. We focus on the demand for the people who it's appropriate for. The Community Resource Unit and the Central Wisconsin Narcotics Task Force have supplied 37% of all of the referrals that we have gotten for deflection, which I think is a really humanizing element because it shows that these officers really care. They want people to do better. They want them to get better, and they want them to be productive members in society instead of having the classical arrest them and put them in jail to sit kind of mentality. So we're asking them to do something pretty profound by considering another alternative for accountability, and they have really shown up for us. And last but not least, we do have a deflection assistant for the first time since our program started, and we're really excited about that. Laura's position is here to support us with data entry, program support, and organizational efficiencies. Her position is important because it helps us not only focus on data integrity, but continuing to evaluate our programs so that we can regularly analyze what are we doing, how well are we doing it, and who is better off because of it.
Okay, so here's some data for our deflection program. Dana has been the only staff member in our deflection program for 18 months. Keep this in mind. We just hired someone in August and then someone in September. And so Dana has been spending a lot of time training and onboarding and getting them up to speed. Deflection is a lot to learn. And so Dana has had a total of 287 referrals so far since we started the deflection program, which is a lot of referrals. Where her active cases are usually around 100 to 110. PTAC, which is one of the national initiatives for deflection, and COSEP both recommend around 15 active participants per specialist. So she's working a lot. And when training extra staff, as we all know, that takes up more of her time during the week. So if you look back at presentations, or if you've been a part of presentations before, our success rate used to be at around 94%. Well, over the last couple of months, with all the additional work added onto her already busy plate, we did see a little bit of dip because we're just not able to respond at the rate that we used to. But we know once everybody's up to speed, it'll get back to the 94% that it was. We also have a goal for our service connection time to be around 3 business days, and we were meeting that goal and even exceeding that goal for a really long time. Again, giving new people to new staff, it just takes a little longer for things to work through, and then we're really hopeful to get back to the 3 days sometime soon. The average monthly contacts part, this is per person. So this is an intensive caseload. These people need a lot of help. Dana does not just connect them with, say, hey, here's your list of counselors, see you later. She connects them with all the recovery capital that they need to be successful, which is housing, food, all the things. And it's not easy to get into treatment. It's not fast to get into treatment. We've worked a lot with North Central Healthcare, and they've been an amazing partner in this in helping us connect people with treatment faster so they don't have to wait the typical 90 to 120 days that many people have to wait if they call like right off the street. So it's a lot of work, I guess is what this data says. And Dana's just doing great overall. So this really busy next slide. So the Washington State Institute for Public Policy, they have done a lot of work on trying to figure out return on investment for programs. So they have done, a meta-analysis means like somebody goes and looks at a ton of different research. Their meta-analysis was through the whole nation. So they took a bunch of research studies across the nation, brought them together, have a ton of research, and then this is the cost analysis they came up with. How much money are we actually saving counties when we have programs like these? So this specific cost analysis is related to Washington State's Law Enforcement Assisted Diversion Program, which is deflection. So for every one person that goes through this program, benefits Washington State $19,000. But since ours is grant funded federally, our total benefits would be the $22,000 per person per year. So cost benefit wise, we've had 54 successful participants in 2025. Our grant funding was $150,000 for that year. And then about 40% of my position is allocated towards this person, or towards this position, sorry. So net savings per year would be estimated at $1.172 million for just the deflection program. So expanding our program, I would expect to see a projected savings of 4.55 by basically tripling the amount of work. I 100% predict that adding more people will add more referrals. It won't just be a better staff to participant ratio. We're definitely going to have a lot more referrals. So before we transition to diversion, I kind of wanted to go through the differences between deflection and diversion. A lot of people use the words interchangeably, and they are not the same. Deflection is law enforcement led, like I said before, the yellow and orange area. And deflection really works on building recovery capital. They work with people who have substance use challenges. They work on housing, employment, healthcare, all the things. Dana connects people with primary care providers because a lot of them don't have a primary care provider. It's really intensive work. Diversion, we have a lot more volume of people in diversion, a lot less intensive, a lot of these people have less needs. This is prosecutor discretion, smart prosecution. It's basically helping repair victims, set accountability for the offender, and ensure public safety. Because a lot of times when we make sure that things are best for the victim and the offender, it's usually best outcomes overall with reducing recidivism and have that in mind for public safety. So again, smart prosecution is a person-centered approach. I kind of see ourselves as like a tool for prosecutors to use when they're trying to figure out creative ways to solve their cases, or like this punishment doesn't really make sense for what happened in this incident for this crime, because each crime, there's a lot of things that can happen to fall under the category of one crime, but it's definitely a spectrum. And sometimes jail or prison makes the most sense. Sometimes something more catered to the situation makes more sense. So we're here to hopefully have win-win resolutions with defendants, victims, prosecutors, defense attorneys. All around is what we try to do, is consider the system as a whole. So again, purple and blue areas is what we're focusing on next. The blue area is our pre-charge diversion program. The purple area is our post-charge diversion program. So pre-charge is before it shows up on CCAP. Post-charge is after it shows up on CCAP, if you guys know what CCAP is. All right, so for cost for diversion. Nikki's position, along with 40% of my position, is at $140,000-ish per year. And then we also have 4 case managers at Attic Correctional Services that cost approximately $317,000 per year. So the total cost is around $414,000, but we do have a fee for this program. We do not have a fee for deflection, so we do have some revenue coming in to offset the cost.
Welcome to Diversion Land. So our pre-charge diversion program has 3 different subtracks, and the benefits, as Ruth mentioned, are that upon successful completion, there will be no public-facing CCAP or arrest record. Our goals are to connect individuals to treatment sooner than the criminal justice system traditionally allows, and also getting to restore victims in a more timely manner too. Most crimes are eligible under our first-time offender subtrack. They're generally low-level misdemeanors with low-touch agreements, which are short and deal mostly in natural consequences, such as letters of apology and restitution collection. A good example of a crime that fits within this program is, imagine a fight at a local high school where the offender is 17. Typically, the context in which people understand punishment in school is that they're going to get a detention. Well, unfortunately, at 17, you are legally an adult. And if your victim is legally a child, you may get referred for a felony. So some felonies do fall under the diversion program for first-time offenders, but again, that is prosecutorial discretion, and we center the victims within this decision as well. When the operating after revocation and operating without a license program was created, these types of misdemeanors were taking up 20% of attorney caseloads, which was causing significant backlog in the system. So this program, its goals are to help people get their licenses back, so simply they can be more productive members of society and work as they need to. It is with the help of a case manager that they are able to interpret what the DMV needs you to do, because as we know, clear as mud, trying to work with the DMV. So it's also extremely expensive for individuals to get their license back after they've gotten an OWI. It could be over $1,000, so that often includes the case manager counseling individuals on financial planning, budgeting, and seeking resources in the community that might be available to them to assist them in the process. The truancy program is working with the parents who are referred over for contributing to truancy, and that's a collaborative effort alongside the school. So imagine that the typical criminal justice process takes 9 months from start to completion, typically. So in intervening with parents, you're either taking a chance with the traditional process taking 9 months, school is 9 months, so that is then the year after where we get a proper intervention in helping that child get back to school. So through the diversion program, we're typically connecting parents with services within a month. So that way we can focus on getting that child to school while also connecting the parent to what they may need to be successful. That could include parenting coursework, referrals for substance use, resources. It can be a lot of things in those agreements.
All right, here's our data card basically for our pre-charge program. I want to note before talking through this that this data is through 2023. This happens to correlate with the same time as we started the deflection program, and there's only was 3 of us at the time starting a new program, doing a lot of work. So we still document data. It's just the time to have staff put it together and show it and make sure that it's presentable is just non-existent. So we are working with administration to hopefully solve some of those issues, but at this time, we have clean, accurate data as through 2023. But it's been pretty consistent over time. The first increase in case referrals was due to our OAR program starting, and then the second increase was due to our truancy program becoming more utilized by schools. So, but overall, it's been staying pretty consistent. Typically, we have 219 open cases at a time. So that's a lot of people that Nikki's working on with added correctional services. She's referring people to case workers and just making sure that people comply with their agreements. And then as of the end of 2023, we had raised over, I guess not raised, but collected, that's the great word, over $160,000 in restitution for victims. Average recidivism is 16% for pre-charge diversion. I have done different analyses over time, and it's remained pretty consistent between 15 and 18%. which is significantly below the average of the state.
Post-charge diversion. We have three subtracks there as well, and the benefits differ from pre-charge in the sense that defendants in this program are potentially getting a reduced criminal record upon successful completion. That can look like dismissal or amending to something lesser after a charge that they've pled to is initiated. Again, this program has the same goals in connecting individuals to treatment sooner and restoring the victim. Most crimes are eligible under the first-time offender track and post-charge as well. People in this subtrack and prior to in the pre-charge are mostly young adults, though we serve all ages over 17. The types of agreements that you would see in post-charge are more involved and more intense, and we have bond considerations that are an important factor here as well. So considerations for safety. A good example of a crime that would be eligible for this program are domestics, in the sense that a lot of people are not well versed as to what a domestic is. We all watch TV, so how many people are accidentally taught that posturing is okay, having loud arguments in public, door slamming, etc. These are the types of things we hear defendants say that they did not know was illegal. So clearly then, subsequently in their agreement, there's a lot of counseling that's involved. So these are the types of things where defendants take accountability, we work on repairing harm with the victim, while also offering that education and counseling. The first-time felony track is a tool for smart prosecution in the sense where defense and prosecutors are negotiating to reach agreements that are ensuring public safety through accountability and serving misdemeanor probation. Now, diversion's contact with that individual is minimal so that we are not duplicating services and case managing on top of what a probation agent is doing as well. So victims are made whole through various means, again, as I've mentioned, restitution collection. And offenders in this track are eligible for that felony to be amended to something lesser or dismissal upon successful completion. An example of a crime for this one is think of a felony theft. So victims can potentially be getting their restitution a lot sooner than the traditional process. Other smart prosecution endeavors that we have in our office are considered around best outcomes, and those can include plea negotiations and victim considerations, just as a final recap.
Data for post-charge diversion, same thing through 2023. There are a lot more active cases in post-charge because agreements are usually longer, for one thing, and two, just a lot more people end up getting diversion offers through negotiations rather than for pre-charge. It's typically the prosecutor themselves making that decision. So we've almost collected $1 million in restitution, very similar recidivism rate as pre-charge, and then referrals overall have been pretty much steady over time. So going back to another WSIPP meta-analysis, this one, they call it jail diversion, but if you dig into it further, it is a meta-analysis on both pre and post-charge diversion. There is a very different cost savings in pre and post-charge diversion because pre-charge doesn't even touch the court system. A lot of them don't touch the jail, but there isn't a really good benchmark for us to use to be able to parse those two apart. So since we do have tax levy in this one, the benefit cost that we have is minus cost is $10,000 per person. So again, in 2024, tax levy was about $414,000. And then we collected $37,000 in participant fees. Our fee structure has changed significantly since then. If you want me to go through that more, I can do that. We had 149 successful pre-charge people that year and 202 post-charge. So doing the whole calculation, that year we saved the community $3.23 million. Pre-filing, this is brand new. This is like a smart prosecution idea that there is no national standard because it's a brand new idea. And this program could potentially save the county probably more money than any other program, because what it basically does is, instead of people being prosecuted and showing up to court for multiple hearings, we try to do all those negotiations and stuff before we charge the person, so that we have one hearing instead of 4+ hearings per person, helping with court backlog. These people would not be on bond during that time for the most part. A lot of significant benefits. So that is a smart prosecution grant of $100,000. That grant ends in like 20 months from now. And we don't know about continued funding, but that is something that we'll work with administration to figure out, and we're definitely trying to keep our data so that we can show the benefit of that program. So tax levy for this one is 20% of my time goes to this new program, and so that's where that tax levy comes from. Pre-filing, so we kind of have different parts of what pre-filing is, but our main goal, again, is the expedited program. We also have a special victim units program, so we can do a lot of work with victims before charging a case, and then a veteran program. Our county has wanted to start a veterans court for a really, really long time, and we just don't have the population of people, or don't know if we have the population of people, so we're kind of piloting this as like a pre-charge thing, or a pre-filing, I guess, program, and I'll get more into that in a little bit. So basically, the main benefit overall is it's just faster. And the prosecutor can make a more informed decision because they have all the information before charging. And then criminal history continuity just means basically that instead of the prosecutor charging what was referred to them by law enforcement, they can take all the information into consideration, and then the charging history and their conviction history would hopefully match. So then it doesn't confuse employers, and there's a lot of sticky stuff that can happen if they don't match. So anyways, expedited. Our goal is to sentence someone within 30 to 60 days. Typically right now it takes about 9 months-ish for a case to get completed in a typical case. And then, so if your incident happened in January, you wouldn't be on probation until September. We want people to get on probation faster, so they're held accountable faster, the community's safer, they can get the treatment they need faster. There's a lot of benefits to expediting the system overall, and most cases are eligible. It doesn't really change a lot of the end resolution of cases. People are still held accountable in the same way they would have otherwise. It just makes it faster. Our special victims program is basically something where we can gather information before we charge it, so we're just well informed in what we charge someone with. So we work with prosecutors on this. A lot of times this happens when there's a late report sexual assaults, like when someone was 12, the incident happened, but it didn't get reported until they're 18, 19, 20. There's just more consideration that goes into those cases than otherwise, and our Nikki helps a lot with kind of trying to help them through their process and make sure they have all the information that the prosecutor needs. And a lot of times too, the victim might say, hey, I really don't want this person charged, but can you please get them help? And those are things we take into consideration as well. Our veteran program consists of a team of a multidisciplinary team of a bunch of people in the community that help veterans connect to services. So we work with the regional team, we work with the local veteran service officer, and then we also work with the job center who has veteran-specific caseworkers, and all these different people show up and we talk about cases and like where people are with their benefits. Do they need to apply for more things? Just are there different things that we can help support this person is what this team helps with. And then we do a pre-filing, so they only have to do one hearing instead of multiple hearings, which can be stressful for a lot of people involved. So outside of pre-filing, this is a transition. We do have other diversion type things that we do that are not like official, this is diversion. Some things like this are considered, we kind of call warm handoffs or informal victim reparation. So an example of warm handoff is somebody is having a crisis. They call 911. The law officer thinks they probably will qualify under Chapter 51, which means they're at a danger of harming themselves or others, but then they don't actually rise to that level after getting them assessed. But law enforcement still thinks that there is a level of public safety risk. So sometimes instead of them getting charged with a disorderly conduct or resisting an officer or some other kind of crime, sometimes involves criminal damage to property, we'll help connect the person with mental health services and make sure that everything is communicated well, it's not just dismissed or whatnot. Also, some people steal soda from Quick Trip when they have a guardianship, so they're not a guardian of themselves, but they have a guardian over them, and they still do crimes. They steal a soda from Quick Trip is a common one. So we will work with the guardian, help like make sure the money gets paid back, and look at ways to help make sure the person does not steal anymore, to help protect the public. Like what are innovative things that we could do to prevent this person from stealing? Also, sometimes the prosecutor is thinking of not charging a case, but there needs to be some kind of victim reparations still. And so instead of charging them, we might just do a, like, hey, just so you know, this was a crime, we're not prosecuting you, but there is some victim reparation stuff that we would request, but we don't require. And that's all the tons of things that we do. Questions?
Go ahead, E.
Thank you, Madam Chair. I just want to get some clarification on the JAG and COSUP grant here. How many years is that for? Is it a renewal grant? Are we maxed out at certain years?
JAG is every year. I don't foresee that going away. We just have to renew it every year with the state. And then COSUP is guaranteed for 2 years with a possible third-year extension. And then also there are opportunities like the state continued funding with JAG funds too or something like that. We're not sure how that will look.
Is it a competitive grant at all?
Well, the JAG grant is not competitive. So the JAG grant, you have to be already in the deflection program to get that funding, but COSUP was competitive, yeah.
And there's no matching grant?
Nope, no matching requirements for any of them.
Okay, thank you.
You're welcome.
Any other questions from the committee? No? That was very interesting. Thanks. Congratulations on a job well done, and keep it up.
I appreciate it. Thank you so much for having us come here, everyone. I appreciate it.
Oh, thank you. Okay. Thank you. All right, 6C, we have our Chief Medical Examiner here, Dr. Leah Schuppener, and she's going to give us an update on the Medical Examiner's Office. He'll help you.
Oh, you want that up there?
Is that okay?
Yeah, can you,
Do you want me to email it to
you
you?
want to email it to me and then I'll.
Apologies, just 1 second. It's small. Yeah.
I was gonna say, Blanche, don't touch.
I'm sorry, I didn't know I had to send it in advance. It's okay. They know you. It's okay.
Well, hey,
Is it okay to plug it in?
Yeah,
Okay,
other duties as assigned.
there you go.
It's my
Perfect.
fault. I
See?
didn't give you enough time to download it onto the packet.
Oh, no, it's totally fine. This is my first. Hello, thank you for having me. So I'm here to give a facility and operational update on the medical examiner's office. So I think I have seen most of you, but I don't think I formally met everybody. So I just wanted to go through a little bit of my background since I haven't met everybody. So I'm actually a Wisconsinite by birth. I was born and raised in the Wausau area, and I graduated from DC Everest a long, long time ago. I'm a board certified forensic pathologist and actually got my start in UW-Platteville with bachelor's degrees in biology and criminal justice. I then went to medical school at Des Moines University in Des Moines, Iowa, completed my anatomic and clinical pathology residency at the University of Wisconsin-Madison, hopped over to Minneapolis for a one-year fellowship in forensic pathology at the Hennepin County Medical Examiner's Office. And following all that training, I actually spent 4 years on active duty with the United States Air Force with the Armed Forces Medical Examiner System. After I separated from the military, I served as the deputy chief in Brown County over in Green Bay for a year prior to becoming chief here in Marathon. So some of the updates we have is we have officially completed our formal transition to a physician-led system. So what does that mean? So in a physician-led system, the chief medical examiner is a licensed medical doctor, ideally a board-certified forensic pathologist, although that's not the case in every jurisdiction. What that meant is that Jessica Blahnik, who was was our chief medical examiner, transitioned to our director of operations. And then we are also fortunate enough to have a second forensic pathologist employed by Marathon County, Dr. Kate Schubert, and she started in August. So there's 2 of us in the office. And then obviously the rest of our staff, an autopsy supervisor or assistant, Grace, an investigations manager, and then 3 positions for medical legal investigators. So some of the important milestones we've met so far this year: construction has been completed on the Marathon County Forensic Science Center. We were able to move into the facility on July 10th of this year, and just over a week later, we completed the first autopsy in the new facility. On August 13th, we had our grand opening ceremony, which was for politicians and major donors that helped us get the project up and running. And then since some of you have not seen the facility, I thought I'd go through and give sort of a virtual tour of what the building is. So this is the outside of the building and sort of our main entrance. Behind the building on the back side. And this is sort of the street view with the entrance to our Sally Port on the left through the garage door. This is our Sally Port. So this is where funeral homes, outside referral counties, even our own medical legal death investigators will come in and out, sort of intaking and releasing decedents from the facility. It was designed with mass fatality in mind, so not pictured in here as a separate garage door where if needed we could hook up a refrigerated semi-trailer to expand our storage capacity, whether that's for an incident in Marathon County or if a surrounding county came to our office for service and needed storage space for like a mass fatality incident, we could accommodate that. Sort of off to the right of this picture, it's a little bit cut off, there is a separate door that leads to our tissue donation suite. So what some people don't know is that after death, people can donate tissues that can go into living recipients. So long bones, skin, heart valves, pieces of the eyes, things like that. And so we have contracted with multiple tissue donation recovery agencies here in town. And we have a suite that they can use at any hour of the night. They can come in within the 24-hour window that they need to collect those tissues, and they can recover tissues either after the autopsy or prior to the autopsy. Within that recovery suite, we do have a special cooler door that leads into a separate cage within our cooler. This allows us to put a decedent that's going for donation in secure storage just for the donation team, but then they don't have access to the rest of the individuals in our custody. This is our entrance into our intake area from the Sally Port. In here, we have an in-floor scale where we can weigh decedents when we bring them in. We can intake and release decedents as well as personal property and effects and evidence if we have anything collected that we've been storing for law enforcement. This is just another look in the cooler, so it's on the other side of that cage in the main cooler. And then within our cooler, there's a door to a separate freezer. At any time, the freezer can be converted into cooler space. And so total with our racking system, we can house comfortably 49 decedents. Again, if we needed to house more, we have the option for that refrigerated trailer. We are extremely fortunate to have a full body x-ray machine. It's called a Phobos. And so there are certain cases that forensic medical guidelines say that you have to have full body x-rays, gunshot wounds, victims of fires, things like that. And so in some offices, if you need full body x-rays, you're required to take plain films of each of the limbs, the head, torso, etc. But this machine can take a front facing and side facing full body x-ray in about 20 seconds for us. And so every case that comes through the office does get that. This is a look into our main autopsy suite. So you can see we have 2 sort of freestanding tables in the middle of the room, and then not pictured in this is a third station that's actually wall mounted as a bariatric station. And so we're able to perform cases in here. Both Dr. Schubert and I can work simultaneously if need be.
You can see on the walls that big black square is actually a near life-size television monitor where I can project that full body x-ray. For example, if I'm looking to recover evidence that's retained in a body, I can have the image right in front of me while I'm working rather than having to go back and forth to radiology. We also have an isolation suite, which if somebody has advanced postmortem changes, or if we have students that are coming to observe the case, or if law enforcement wants a closer look at the body, we can work in the suite, and this has additional technology for us. So I have speakers above myself, and there's one in the observation suite where I can talk back and forth with law enforcement. We have cameras over both the body station and the physician's dissection station, and we can toggle between the two. So for instance, if I'm eviscerating something in the chest cavity, I can zoom in on that and then project it onto a TV screen in the observation area so that law enforcement, even though they're not right at my side, can still see what I'm doing in the body cavity. This is what that observation suite looks like. So this is where students and law enforcement, referral county medical examiners and coroners sit and observe the cases. You can see we have the TV screen mounted on the wall there, and that's where that will project for them. This is their view into the main autopsy suite, and likewise into the isolation suite. This is just a picture of our main entrance, but we wanted to highlight the donor wall. This is just a rendering. The official one has not been put up yet, but it highlights all of the people that made the project possible for us. We do have an extremely nice conference room where we can host outside counties, law enforcement trainings, things like that. And then we're also fortunate to have a family room. So if there's ever a time where family members need to come to the medical examiner's office for something, if we need to talk to them in the presence of law enforcement, we have a warm space where we can welcome them to the office. So some of the services we're currently offering, so obviously forensic pathology services. So we do this for both Marathon and referral counties. So we can do basically 3 types of exams: external examination, which is just looking at the outside of the body and that x-ray, or we can do a full postmortem exam where we also look at the body internally. And then there's also subspecialty consultations where sometimes law enforcement or outside agencies just have questions. They want us to look at photos and comment on something or interpret an injury pattern, and we can do that as well. We also do medical pathology services, which is unique to this office compared to some in the state. So we do hospital autopsies. We're currently working on formalizing contracts with Aspira Swassa Hospital and Marshfield. And once those 2 are underway, we'll branch out and reach out to other hospital systems in the state. For instance, if somebody comes into the hospital, is there for 24 hours, they haven't officially made a diagnosis, and then they suddenly pass away. It's probably medical if there's nothing suspicious, but the clinical team or the family still wants an answer. We can then perform a hospital autopsy in that case. In some cases, we'll also perform private medical autopsies for families. Very similar situation. Maybe a person of advanced age passes away and family just has questions about certain things. The family can ask our office to provide that service for them. And then tissue and surgical hardware removal. This is also unique to our office. So if family is in a position where they want, for instance, surgical hardware removed from an individual before burial, they don't need an autopsy, they just need that thing removed. Dr. Schubert and I can also do that in the office for them. So where are we as an office other than services? So we are transitioning staff currently still into the new roles within the office. It's very easy for me to say that we just transitioned to physician-led, but that is a huge undertaking for staff. And so as we're sort of adjusting and learning new roles in the office, it does take time. For instance, our medical legal death investigators, they were previous medical examiners. Their job duties still have not changed. They still respond to scenes, work with families, but now they're also learning to be autopsy assistants at the same time. So it's a big undertaking, but everybody's been taking it in stride. We're working to establish new policies and procedures and sort of identify the best workflows for the office, especially when we're bringing in referral county cases, and how do we best work with referral counties in different areas. And then some people don't know this, but we had a medical legal investigator resign a few months ago, so we've actually been working understaffed for just a little bit of time, but we're excited that we hired another one who's starting at the end of this month, so that'll bring us up to our full staff of 8 people. We are currently expanding operations. So as I mentioned, we're onboarding referral counties for those pathology services. So at this point, we have 8 onboarded, and it's those listed below: Lincoln, Portage, Monroe, Marinette, Shawano, Price, Burnett, and Clark. We have sent out welcome packets for possible onboarding to roughly 40 counties in northern Wisconsin. There are some counties actually in southern Wisconsin that have reached out, and we've sent them that information as well if they request it.
We are also trying to establish working relationships with other physician-led offices in this area of the state, so northern Wisconsin. So Brown County and Fond du Lac County both have physician-led offices. However, they only have one forensic pathologist in each office. So if that pathologist ever goes on vacation or is out of town or their caseload exceeds what they're able to complete in a reasonable amount of time, then we're able to provide backup coverage or service for them as well. And then we're still looking at the ability to participate in educational opportunities. So having students in, hosting conferences, that sort of thing, making sure all the technology is working appropriately, and that it can be the best positive experience for students possible. And I kept it brief, but I would love to answer any questions.
Very interesting. Go ahead, Deb.
So are you still hiring staff?
Currently, now that we have that medical legal investigator hired, we're considered at full staff. However, once we start taking on more referral county case volume, we're assessing the need for additional staff. For instance, we don't have anybody working the front desk. All of us just sort of take turns answering the phone, even in the middle of an autopsy. If it rings and we don't have anybody available, I'll pick up the phone. Additional medical legal investigators, if we end up sort of being up all night, sort of letting in referral county cases and working with donation, that'll sort of tap out what we have for investigators. And then potentially a second autopsy technician, so.
I think,
Yeah.
Any other questions from the committee? That was really nice to get the new tour again.
Yes.
It recognizes everything from,
The pictures turned out really good, so.
thank you so much.
Thank you. Okay, I'll let you put that back. Thank you.
And we don't want Lance touching.
Yes, thank you.
It was so great. I appreciate it so much.
Thank you.
Okay, thanks a lot, Dr. Schupener. Next, number 7, our next meeting date and time, announcements and future agenda items. 7A, committee members are asked to bring ideas for future discussion. And our next meeting is Tuesday, December 9th, 2025 at 1:30, and I think Lance has something to say.
Yeah, I apologize. There was a request previously, I believe Supervisor Hoppe wanted a presentation from the judges relative to failed appearances in the court system, and I meant to put it on this agenda and talk with the judge about it, and I completely slipped my mind when speaking with the chair to get that on. So I met with the judge this morning, and we'll put that on your January agenda. She's not available in December, but I apologize for missing that.
Thank you. Go ahead, Yi.
Thank you, Madam Chair. I guess the question for Lance is there, I know that there's several people that came to talk about the 287G, and I know that we're in a lawsuit at the moment here. Is it possible for us to go into closed session for information regarding that?
I can speak with court counsel, and we can get back to you on a future agenda item based on the public comments and any questions you might have. We'll talk about that.
Thank you. I'm only saying that because I have over a dozen emails and phone calls as well too. So I just want to make sure that we're doing our due diligence as well. Thank you.
Understood.
Wow. Okay, is there anything else from the committee? Thank you all for coming, and thank you for your presentations. They were really great today. Thanks a lot. Okay, number 8, you want to go home?
Second.
But who made the move? Nick? Oh, Al, okay, and Jason did the second? Okay, thank you. All in favor of adjournment, say aye. Aye.